So welcome to Friday Focus, February 10th, 2017. So we talked a couple weeks ago about how some of the founders' mentality concepts got lost in the office and people have really gotten segregated and sort of trained to do just one thing in one department. I've really been working with the teams to sort of break that loose. What happens in a business as it grows, there's a tendency for administration and bureaucrats to try to really narrow down people's scope. Tell me exactly where we're going to be, exactly which hours, what you're training on. Reality that we started this business by people being able to do kind of every job. And even if you are not an expert at the other jobs in your office, you should have a basic working understanding of them. And I've been wanting to really encourage people to spend time, even block your production, to be able to work on with those other teams so you understand what they're doing. It makes you really flexible. And it also helps you with something that we're going to talk about now. So one of the issues is that we have to grow our business. And this is a reality in the business world, okay, is that you grow or die. Okay, so now a medical practice might be different because usually the medical practice grows until the doctor gets old and then he dies and the practice is done. But hopefully this practice lives well beyond my days or my interest in working. And that's for a long time yet, hopefully. But the thing is that businesses that don't grow will die. That's just what happens. If you look at businesses, it doesn't matter what they are, if they did not continuously grow and adapt, they died. And there's three ways to grow a business, and it doesn't matter what the business is, there's only three. There's increase new customers. Okay? And we know what that is. That's for us, new patients. Number two, we talked about this before, increase the size, the sale. And number three is repeat buyers. And that's the only way to grow a business. And the question is, if you have, say, a vein patient, you have a new patient, the size of the sale would basically be predicated by whether or not, you did a mapping and did their production or, just sent them home. We're somewhere between that 35 and 55, 60% of people getting into production. We can improve that. And then repeat buyers, other than their, follow-ups, there's maybe no chance of repeat buying. So what can we do? Well, I've been meeting with different departments on their wildly important goals, their WIG goals. And I was talking with marketing meeting recently, and we were trying to talk about what really do we want to do, and maybe do we want to increase our new customers? That was a previous maybe goal. And that's kind of a hard way to grow. What about increasing the size of sale by marketing to different departments? And what about getting repeat buyers by maybe taking a vein patient and funneling them into HRT or derm or Botox, something that gives repeat buyers, gives an opportunity to serve our patients better? We know unequivocally that only these two patients refer ever. These are not reliable because they might not come back in. They might come in for consult and they don't get anything done. They're not going to refer you anybody, okay? They're not going to be happy if you didn't treat them. So the only way you get happiness is to have a size of sale or you get repeat buyers. And we know from, say, for example, our HRT patients, these have actually the highest value in our practice because they tend to stay with us for a long time. And they have a high likelihood of going into different departments. And that'll ultimately happen with dermatology too as that grows on, and it happens with Botox and fillers. So I was meeting with the marketing team. We were trying to figure out how to maybe communicate with what would we consider those patients who go from a surgery funnel into a repeat buying funnel, which might be HRT or derm or Botox filler or products or esthetician services. And Tiffany came up with the idea of calling them patients that are taking a journey with us. And a journey patient might be somebody that has kind of journeyed through our whole practice. And if you work in the hormone department, you definitely see this. The chart's like this thick. We still have paper charts for those patients. And they've multiple colors. They've had the Botox and the veins and the sclerotherapy. And they've been to our seminars and stay with us a long time. Same thing with Botox and filler patients. I don't have many patients left, but my patients always had a real thick chart because they would come in to see me for Botox every 3 to 6 months. And then when they thought about getting something else done, they were not really shopping us around. They just come here. We'll see the same thing with dermatology eventually when they're coming in for their annual skin checks. When they're thinking about getting something else done, that's they're going to check with us. And those really are our journey patients. And that's really the best value in our practice, are patients that will continue to come back and see us. They're the ones that are going to go to our seminars and have other services offered for them. They're the ones that are going to bring their family members in, refer to us. They're the patients that are going to go to our small events and get some other opportunities that we have to offer. And these are the people that are going to promote us and talk about their experiences here that are unique in the medical world. So the journey patients are really where we need to go. And what's holding that back? Well, I've had patients pull me aside. I had a guy, he came in for asthma. He's 72 years old, looks like he's 50, he takes really good care of himself, but he had asthma. And he came in for stem cell therapy. He lives on the other side of town, I think in Ann Arbor or something, and he came in and got treated, and he really did real well, and then he came in about a year later, did it again because he wanted to feel better. He was off his asthma medicines now for 2 years. And he's in here and getting platelets in his head for hair growth. And he pulled me aside and asked the ladies to leave for a minute. And he said, I'm a businessman. I want to tell you, I'm a little frustrated that I had to ask for all this stuff. He goes, I want to do the Botox and filler. And he says, I'm taking testosterone gel, and I know you had the pellets, but nobody asked me. And the PRP, I had to actually ask for it. And it turns out it's the same ladies that did the stem cells do the PRP, but I had to ask it. Why didn't you not tell me about these things? Why did you make me ask? I was a little uncomfortable about it. And his point was, you should have asked, okay? And sometimes we're thinking, well, what happens if I get rejected? I might ask somebody, you want to go to our seminar next Friday? And they might say, oh, I don't want to. And that makes me afraid of asking again. You got to get over that bias, okay? Because what happens by doing that is you're holding back on your patients, okay? You're keeping it to yourself, things that you know that may benefit them. And you're holding yourself because of your fear of rejection, okay? You got to let that go. If you ask 10 people, what are you doing for your skin care? 2 or 3 of them are going to get skin care treatment. You know what's going to happen? They're going to get less skin cancer. Okay, they'll get less skin cancer because you ask them versus letting them think that you don't care. If you ask middle-aged women, do you know about our seminar for hormones? You know about our hormone program? If you ask 10 women and 2 of them respond, you've just cut the risk of breast cancer and heart disease by over 70% long term. You made them feel better, sleep better, have better sex, better weight, less breast cancer, less heart disease, 72% reduction because you asked. If you don't ask them, they might not ask you, right? Because they're thinking if you're not asking them, it's, maybe not important. For men, middle-aged men that have low testosterone, if they're untreated, the risk of heart disease and premature death goes up by double. You don't ask them, they don't know, okay? They're thinking we should ask them. People that are getting other things done, the hormone patients or vein patients, if you don't talk to them about Botox and filler, bring an esthetician room to meet them, they don't think you really want to offer them that service because the assumption is that if you have something that's that great, you probably should tell me about it. Who knows when the right time is? Is it in the consult? Maybe not. But when certainly getting a patient in for a series of treatments, you need to let them know what we offer. We got to stop holding back on our patients. And for us to grow the business, I kind of want to focus more on these journey patients that are getting multiple things done. You should think about if you're in a journey business like derm or HRT, you should be putting people into high sale business such as, say, veins or surgery. Veins would be a classic one, screen them for veins. And if you're in the vein department or the surgery department, you should figure out how we can get that patient turned into a journey patient. That way eventually we have most of our patients are just kind of staying with us for a long time. We're not constantly running a rat race and trying to get a bunch of new patients. And that's a painful way to grow a business. We're always going to add them, obviously, but how about we keep our patients versus keep adding more and more new patients that we may or may not like or want to do business with. The ones that you're seeing now, you want to do business with them or not. So that's the Friday focus. We're really going to work on that in 2017 in the big year. We're going to work on getting our brand promise delivered more consistently, get patients for life, not just patients for the one day. Thank you.